Good afternoon, everyone, and thank you for joining us. This is Paige Hancock, Marketing Manager at Spok, and I'll be moderating today's webinar. Today, we'll be talking about enhancing your data security, closing the gap on unsecured communications. Tom Sain, Chief Information Officer at Spok, will share industry best practices to help your organization secure your communications and protect patient information. Before we get started, I would like to go over just a few housekeeping items. Everyone will be muted during today's webinar, but we do welcome your participation. Please submit your questions via the questions box, which is in your GoToWebinar toolbar, and then Tom will answer as many questions as time allows after the presentation. A recording of this webinar and the presentation slides will be sent to all registrants tomorrow, and we encourage you to share those with others at your organization. And at the end of the webinar, you'll also have the opportunity to complete a brief evaluation. We would love it if you could take just a couple of minutes to complete this survey. Your feedback really helps our efforts to provide you with relevant and informative presentations. And with that, I'd like to turn it over to Tom, who will begin today's presentation.
Thank you, Paige, and thank you everybody for joining us today. Security is an aspect that's near and dear to my heart as Spok's CIO and security officer, and hopefully we'll cover some topics today that are meaningful to you all. And as Paige indicated, if any questions come up during the course of the presentation, please submit them via the chat bar. I anticipate we'll probably take 20-25 minutes on the presentation and then leave a bit of time for Q&A at the end. Really, what is the problem statement here? As most of you probably aware, that Spok's primary customer base is in healthcare, so we'll be concentrating on healthcare aspects of security in this talk today. But healthcare is becoming more and more of a target for the bad guys out there for cyber attacks. It's one of the top 4 most vulnerable industries, according to various sources out there, and there's been a 63% increase in attacks against the healthcare industry over last year, and a lot of that is driving on economics. The reality is, when you steal someone's credit card information, you have access to that spending on that credit card, and the credit card companies are getting pretty good at identifying fraudulent charges and shutting down cards pretty quickly. And so on the black market, a credit card information is worth about $3. But what happens if a health record is compromised? The wealth of information that's contained in a health record is not limited to simply a credit card. It's got all kinds of information, could include your social security number, name, address, medical ID numbers, and it may include credit card information as well if you pay your bill with a credit card. And right now in the black market, it's estimated that every record that's breached and put out there is worth about $60. So it's very much a economically rich environment for the bad guys to go after, and therefore us that are in the healthcare community have to increase our game on securing our environments as best we can. So it really is a hotbed of targets, and you've heard lots of things in the news over last year about that, more so than you would have heard 3 or 4 or 5 years ago. And then you know, some of the environments, when we worked with Chime last year and did a survey of CIOs within the healthcare environment, some of the data that came back was a little bit shocking in that 39% of the respondents in market research indicated that the healthcare companies were not prepared for cyber attacks. You know, and 20% of the CIOs estimate the data is shared via unsecured messages, and there's many ways to share data. And 46% of employees within the healthcare community admit not following policies and procedures. Now, we don't believe that is with malicious intent. It's just people like to take the easiest path forward, and when you add security layers, it makes the complexity of completing tasks go up. So it is an issue that we all have to deal with as we work through security measures within our companies as we go forward. So you know, the importance of a good security posture is really multifaceted. It's not just protection of data. You know, an institution's financial well-being could severely be impacted if there is a breach, not only in the cost of recovery, but penalties that are associated with compliance and regulations. You could have reputational impact such that we all know healthcare is becoming more and more of a competitive environment, and customers that are patients that have a choice of where do they go for services. If a company's had a breach, you know, evidence and studies have shown that people are less likely to go to that organization in the future. So your reputation gets tarnished, and then therefore your revenues and your patient care numbers go down. You could also lose, patients could get the wrong information, because breaches of security don't only steal data, they could you know, maliciously falsify data or manipulate the data such that the wrong medicine goes to the wrong patient because someone's maliciously updated records and changed a medicine that was supposed to go to patient A and now goes to patient B. The records would show that it's supposed to go there, but it's just not the right thing to do, because that is a possibility with the security breach and accessing data. And then also any healthcare organization that's involved in research, that research is really valuable not only to solving health issues in the future, but economically research is done for business reasons. And if that data is breached, you have a loss of intelligence that your organization has spent a lot of time and money gathering and researching on. So it really is a multifaceted impact that any type of security breach or vulnerability could contribute to your organizations. And as we look at how do we better prepare our organizations to limit the exposure to a security incident, it really is not a single-threaded activity. It really is the typical three-legged stool that has to be approached from a security perspective. Obviously, we need to engage our people. They have to play a critical role in our security posture. We have to have good processes and procedures so people know what they're supposed to do and how they're supposed to do it. And then obviously we have to have underlying technologies that help protect our environments from a security perspective as well, such as firewalls, spam appliances, etc., malware, virus protections. One of the key principles also is no single thing or aspect of security will protect you. You really have to have a multi-layered approach to your security framework. You know, a defense in depth type of approach. You have to have many layers of security protection in your environment, and they can be a mix of the things that are on the screen, like encryption and VPNs and monitoring capabilities, firewalls. This is not an exhaustive list. It's just an example that any security framework or posture has to have multiple layers, because the more layers you have, the harder it is for the bad guys to get into your environment. If they have to breach just one security aspect, that's easier than breaching 4, 5, 6, or 7. And it's just that's a little bit of common sense there, I guess. And then you know, it's not just the access into the environment as a whole, but make sure your technology, you know, servers, as more and more of us move some or all of our technologies into the cloud, make sure your storage technology, whether it be on-premise or in the cloud, really conforms to a solid security framework, that we protect systems and data. One of the biggest things that I'm hearing now or getting involved in now is at the root level, what are we doing to classify our data and adding appropriate data tagging such that we know where protected health information is, or PII or PHI, where is it within our data storage environment, so we can ensure that data is secure, encrypted, but it's also retrievable if we have to purge it from the systems. you know, with HIPAA and the GDPR in the UK these days, or the European Union, if someone opts out of you retaining their data, their PHI, you have to be able to go into your system and remove that particular person's data if they so request you to do so. So having good data classifications and data tagging and storage technologies allow you to do that more effectively. And again, when we're dealing with the cloud environment, we also have to make sure that the vendors we're using, that their security policies and procedures, their rules and their technologies are in line with your objectives from your organization as we look forward to those. And it's just not storage, there's all aspects of it. We're going to cover a few of them here. Another big vulnerability we're seeing today is in healthcare is the smartphone. Physicians have adopted smartphone technology extensively. We're seeing an uptick in the nursing community also taking advantage of smartphone technology. So when you're looking at your deployment, whether it's a BYOD perspective or institutionally owned and issued device, really make sure that you have security policies, procedures, and functions around it. And we really, one of the primary ways of making sure you can manage through that is with an EMM or it's also referred to as an MDM type of architecture. There's many of them out there on the market that you can use. We're not endorsing one over another. And really from a security perspective is from a mobile standpoint, make sure you have safeguards in place that limits who can get on your network, what applications they can have on their phones, ability to wipe data associated with your health records if it's on a mobile device, and lock out devices if they're lost or stolen. It's really something, an aspect that we encourage our customers to look at every day. And again, there's lots of places to get tips and best practices out there. Some of the ones that are less common, InfraGard is a relationship of, between the private sector and the public sector managed by the FBI that is designed to safeguard the infrastructure of the United States. So if you're not familiar with it, you know, I would encourage you to go and research InfraGard. It may be an organization you want to join. If you're a member, you get access to bulletins from the FBI on security threats that are out there and vulnerabilities, but also you get some services that could help you with forensic analysis. If you ever did have a breach, they may be able to bring in some forensics expertise that you don't have in-house that is available to members of the InfraGard. Obviously, if you're in healthcare, HIPAA rules and regulations, as well as high-tech, fully document what your obligations and responsibilities are. And then NIST is a national standards organization where most of the security frameworks and rules map back to. Again, lots of information if you just go out to the NIST website to pull down the security frameworks and information on that. And there's an organization, ISC Squared. It is an organization that does certifications of different disciplines. You know, I'm a CISSP. And my certification is managed by ISC Squared. And there's other ones out there, and I'm not pushing this one, but there's also a wealth of data out on their website as to vulnerabilities and security and training, etc. that's available. So this is just a snapshot of some of the places where you can go collect data and get additional information to help you improve your security posture at your organization. When we start looking at some of the processes of what's going on, let's see, I think this is a buildable slide here. Nope, sorry, I'll back up a second. You really need to pay attention to what devices have patient information on them and restrict the access to that information. It's the rule of least privileges. If a physician doesn't need to have access to a patient's records, they should not have access to the patient records. If you know a facilities-based person has a mobile device to manage aspects of their job, but their job doesn't include patient information, they're not part of the care team, you know, there should be safeguards to protect that device from having access to various systems in the environment. So it really is, tracking all devices is important. Mobile devices, another thing that gets commonly overlooked is thumb drives. A lot of people will plug a thumb drive in and copy data off a computer and carry it to another resource to restore. Again, not in most cases not malicious, it's just they're trying to do their job efficiently. But if that thumb drive is not encrypted and it has PHI on it, that is a risk of loss that you're probably not accounted for in your security posture. So it's just all mobile devices, we need to make sure we're aware of what mobile devices are being used in our ecosystems, and that there's proper protections to protect data if it is put on the mobile device. Again, one of the ways to protect the data is proper encryption. Make sure the applications that are running on your devices have encryption. If you're using thumb drives, there are thumb drives that have encryption on them. Make sure that they are encrypted thumb drives, etc. Spok personally does not allow thumb drives because they are so hard to track. But in some hospitals and some organizations do the same thing. But some are willing to take that risk because it makes their businesses more effective, and that's fine as long as the right security postures are put in place to support those. So make sure that encryption is there. A common thing is we're seeing a lot of is the iMessage type technology, the consumer messaging technology that's on mobile devices is being used extensively in care team communications, when quite frankly it should not be. There are mobile applications that will allow you to do that in a secured fashion, and obviously Spok has one in its Spok mobile solution. Sending and receiving of PHI, it's really is, make sure the data that's in your possession, you are protecting it, whether that's you as an individual agent of a company or a company as a whole or a hospital as a whole. Make sure you understand that it's your responsibility to protect that data while it's in your possession. Make sure the data is protected in transit. Make sure you're using encryption. Don't email data in an open email fashion. Make sure you're using an encryption methodology to transfer data. Make sure overall securities are in place. Logins, least privileges associated with it, only giving people access to the data that's necessary for them to do their job, and not more than supposed to do their job. A big part of what we have to do as security people is document and analyze our decisions as to what risks we're willing to take and what safeguards we put in to protect our organizations from vulnerabilities, and the rationale behind making that decision. It's important to understand that things, it helps you educate your user base as to what you're doing and why, but it also helps with regulatory compliance issues, that if you made a decision to do ABC, what was the rationale behind making that decision, and it helps mitigate further issues down the line. All your security policies and everything have to be reviewed on a somewhat continuous basis to make sure that they're in compliance with rules and regulations and updated with the ever-changing threat metrics that your companies are exposed to. The bad guys get smarter every day, so that means those of us that are trying to protect our systems have to get smarter every day as well. Policies and procedures. In any security framework, unfortunate reality is people are the weakest link in the chain. Again, I don't believe the vast majority is done with malice forethought. It's just people by nature take the least restrictive approach to doing their job. So we have to understand that, and we have to develop security postures. That is a good balancing act between protecting the data and also allowing employees to be effective in doing their job. As security professionals, we could lock down systems so tight that the likelihood of a breach is very, very, very small. But the ability of our employees to get their jobs done would be so convoluted and so complex that their efficiencies will go way down, and they would try to engineer workarounds to the security that we put in place. Conversely, we could make our system so wide open, it's very, very easy for employees to get their jobs done and do everything, but by nature we would be exposing data that they shouldn't be having. So our risk factors would go way up. And as security professionals, we just have to find that balancing act to how protect our environments and our data such that we meet regulatory compliance and whatnot, and limit our exposure to vulnerabilities, so we have a good balance of risk mitigation to ease of use. And that's really what we have to make sure we're doing with our policies, procedures, and our systems that we put in place to make sure that we're meeting those goals and objectives. Business continuity. The unfortunate reality is, in most cases, it's, you know, some people will go as far as say it's not if, it's when you'll have a breach. I'm not to that point myself yet. I believe there is still ways to protect your networks that doesn't guarantee you're going to have a breach. But assume that there will be a breach and make sure you have a business continuity plan in place to allow you to recover. You know, there's been stories in the press recently about you know, the malware that is ransomware in your systems, and we've had a couple health institutions in America that basically have been shut down. You don't want to be in a place where you have to pay someone to recover your data. With a proper business continuity plan, proper backup procedures and whatnot, you should be able to recover your operations without having to cave into the bad guys in a certain and give them money to recover your data that you may or may not be able to recover anyways, because they may not be honest people. They're not honest people, or else they wouldn't be locking your systems down. So just a business continuity plan needs to be one of the pillars in your security framework, and from that perspective. Training, training, training. Like I indicated, the weakest link in the chain is always people, and the best way to overcome that is a continuous training environment, which keeps security in the forethought of people's minds. Again, the vast majority of employees are not out there with malice intent trying to violate your security process. It's just not their first thought process. And by way of making it more common in their day-to-day thinkings is continuous training of security aspects of their job, their requirements to help protected health information, and whatnot, and just continuous education. You know, the policy, the rules really require an annual training. Annual training is the minimum bar. We should all strive for better than that, and I believe strongly that if you're not doing training on a much more regular basis than annually, you're opening yourself up for vulnerabilities from the people aspect of security. Again, same thing. It's just make sure you're addressing the human factor. Make your security practices that are protecting your environment, but still making it effective for your employees to do their jobs. Making sure you're training them on the security aspects and the protection aspects of their job that they're required to do. Like I said, one of the big things that we're seeing a lot of in healthcare is using unsecured message for texting of protected health information. There are products out there that are fully HIPAA compliant. Spok's version is called Spok Mobile. It allows you to access on-call schedules, staff directories. It is fully encrypted, both on device and in transit environment, and it does interface into some critical test results, so you can pass results in a short-term turnaround, but still be confident in the security aspects of it. So any organization or healthcare organization that's not deployed a secure texting software package really has opened themselves up to some vulnerabilities that I think it would be worth your while to expeditiously close down by looking at a secure texting package. So I know I talk very fast. I'm trying to get it all in a quick minute here, but you'll have access to the data to look at in more detail. Again, you know, define your hospital strategy for managing sensitive data. It's everything from data classification and tagging to encrypted in transit and at rest data, et cetera. It's a full gamut of that environment. Implement policies and procedures to protect your data while still making it effective for your employees to do their jobs. Look at a multi-layered approach for your security framework. There's not a single a single layer security framework is not going to protect you to the degree you need to do. Look at multiple layers of protection, everything from policies and procedures down through hardware that supports that. Train, 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 train. We have to continuously train our end users on the requirements of their security and the requirements to protect their patient data, just like they protect their patient's health. Again, and be as technologists, make sure we can recover from the unknown. Have good business continuity plans, disaster recovery plans. Whatever the source of an interruption of your business, whether it's natural, man-made, a security issue, whatever, make sure you have plans in place that allows you to recover and continue to provide services to your patients in an efficient manner. So I think that was the end of my speech. Again, I apologize for talking so fast, but we try to keep these webinars to 30, 35 minutes, and we wanted to cover a number of topics there. So with that, I'll turn back to Paige to pose any questions for the next 3 to 5 minutes or so that may have come in, so we can try to address some questions.
Excellent. Thank you, Tom, so much for that presentation. Tons of good info in there. We will take some time now to answer your questions. It looks like a couple have come in already throughout the presentation, but just a reminder that if you do have a question, please submit it in that questions box, and then we will answer as many as we can. So, Tom, the first attendee question is, do you think that the rate of cyber attacks in healthcare will continue to rise?
Yes, I do, and it really goes back to the economics of it. Like I indicated, a health record is worth a lot of money on the black market, and when bad guys can make a lot of money by doing the least amount of work comparative to stealing credit card information, they're going to do so. So I believe the bad guys see healthcare as a target-rich environment. A, the economics of what they can sell a record for, but B, the statistics we showed that a good, I won't say a majority, but a portion of the healthcare community in the United States is not as protected as they should be based on their self-assessment of the rules. So there's a lot of opportunity for the bad guys to make money on us, so I believe it will continue to increase.
Thank you. Another attendee has asked, what level of encryption does Spok use?
Spok uses various levels of encryption, depends on the particular application you're buying. HIPAA rules require an AES 128-bit encryption. Our encrypted pagers from the paging part of our business are encrypted at that level. Our Spok mobile application, which is a secure texting application, encrypts at AES 256, and then our storage environment is at a minimum of an AES 256 environment. So the paging technologies at AES 128, pretty much everything else in our environment is 256-bit encryption.
Excellent, thank you. Another question that came in, do you consider consumer messaging apps a viable option for healthcare?
I do not in the least bit. As a security professional charged with protecting PHI of not only our employees at Spok, but our customers, secure texting is one of the biggest weak links that I see in healthcare today. It's easy to use. I understand that for physicians just to open their iPhone and iMessage back and forth, but that is not encrypted in any way. It's not secured data. It doesn't isolate communications to a care team, and there are opportunities to deploy text messaging applications that are fully secured, have the ability to remotely wipe data, have the ability to set retention levels on them. All the rules that are articulated in the HIPAA rules there are software applications like Spok Mobile that conform to those, and the standard commercial texting applications, just simply do not meet that level of protection and do not meet the HIPAA rules and responsibilities of a healthcare organization. So it's, in my mind, that is a cardinal sin. We should not allow our employees to do it.
Excellent. Thank you so much. It looks like that's the end of our questions today. So that's great. We'll go ahead and wrap up there. If we were unable to get to a question or comment, we'll be sure to follow up with you offline. And if you'd like to chat with a Spok representative on the topics that we discussed today, you can do so using the link that's in your chat box right now. You can also continue the conversation with fellow attendees by using the hashtag SpokWebinar on Twitter. And follow us on Twitter, LinkedIn, and Facebook to get all of the latest news from Spok, as well as industry news and trends. We want to thank you all again for joining us. We hope that you found this webinar informative and that you have a great rest of your day.
Thank you, everybody.